Request all the delegates and speakers, please take your seats. We are going to start the session now. May I request those who are standing behind also, please come and join us. Once again, I request all the delegates, please take your seats. No, wait, I'll call. May I request once again, those who are standing behind, please take your seats. We need to start the conference now. Good morning, ladies and gentlemen. A warm welcome on behalf of Bharat Exhibitions, Bharat Digital Healthcare Summit 2024. I would like to invite the distinguished panelists on the inaugural. May I request Dr. Upasana Arora, Managing Director, Yashoda Super Speciality Hospital, to be on the stage, Madam. Ladies and gentlemen, please put your hands together, welcoming Madam. May I request Father George P.A., Director, Holy Family Hospital, New Delhi, to join with us. May I request Commander Navneet Bahl, Chief Executive Officer, Clear Media Healthcare, please, sir, join us. May I request Father Sabu PL, Director, Fatima Hospital, Gorakhpur, and the Vice President of RUPCHA, please join us. May I request Anthony Prashant, Partner, Deloitte, India, to join us. Now, ladies and gentlemen, we have two digital men from the ministry. May I request Mr. Arvind Kumar, Director General, Software Technology Parks of India, those who are promoting the Medtech, which is called Medtech. Sir, welcome. Ladies and gentlemen, put hand together is welcoming Mr. A. Robert Jared Ravi, the DDG for the Department of Telecommunication, Ministry of Communication. He looks after all the standards and everything. And he was the CTO for the Tamil Nadu before coming here. Before that, he was TRI. Now, Mr. Arvind and Mr. Robert are my old good friends. Nice to see them after a long time back on my head table. Thank you. So before we get into the sessions, what the digital health is going to talk, let's take the blessings from the God. May I request Mr. Robert Ravi to please light the lamp. Along with, I request Mr. Arvind Kumar and all the distinguished panelists, Madam, everybody to please join, all the fathers, please join us for lighting the lamp. Thank you. Sorry, I missed out Mr. Joydeep. Please join us.
Vakratunda Mahakaya Surya Koti Samaprabha Nirvignam Kuru me Deva Sarvakaryeshu Sarvada. सर्वकार्येषु सर्वदा वक्रतुण्ड महाकाय।
Once again, a warm welcome. Good morning, ladies and gentlemen. Today, I stand to shed light on the revolutionary emergence of digital health solution and how they are poised to positively impact the lives of rural population around India. We've been talking hospitals, now we are talking hospitals to smart hospitals, which is very important in today's era because we are only reaching to the urban. There are still people in rural areas which we not been able to reach out. That is where the digital health is going to help. So I'm very happy to, let you know that we have a beautiful panel here. We have hospitals, we have the ministry, we have the RUPCHA associations, and we have all the partners, various partners, those who do the digital health. We also have people from the nursing colleges and almost all the nearby hospitals, nursing directors and doctors and MDs, medical directors, all are here. And you will hear them in all day how the digital healthcare is going to change the life of this country. The government pushes a lot on digital health, starting from checking your lungs up to the pregnancy. I was very happy to see yesterday a demo how a pregnancy lady can be monitored from the day 1 till the delivery and after the delivery. So I request all of you, when you get on the break time, do visit all these stalls to see what all they have to offer you for the digital things. Rural populations have long faced significant challenges when it comes to accessing quality healthcare services. Limited healthcare infrastructure, a shortage of healthcare providers, long distance to healthcare facilities have often resulted in delayed and indicate medical attention for those living in rural areas. That's a big concern. And I'm sure the panel will also address on that because it's a big concern for our country. 140 crores of people in this country, and we talk big things, but still the rural people is far away from the reality of called health. Furthermore, digital health solutions are empowering individuals in rural areas to take charge of their own health and well-being. Mobile health applications and wearable devices and enabling individuals to monitor their health parameters, track their fitness level, and access vital health information in real time. This proactive approach to healthcare not only promotes preventive care but also enables early detection of health issues, leading to better disease management and improved overall health. Without taking much of a time, let's listen to the experts. What do they have to talk about on the digital health? Ladies and gentlemen, I invite Father George P.A., Director, Holy Family Hospital, to address the gathering. Father George.
Respected dignitaries on the dais, the delegates, ladies and gentlemen, we are in a digital world. Digital health is a rapidly growing field that offers exciting opportunities for innovation and improvement in healthcare delivery. The goal of digital health is to make healthcare more efficient, accessible, and effective by leveraging the power of digital technology to collect, analyze, store and share health data. Digital healthcare interventions refer to the use of digital technology and to get connected devices to improve healthcare outcomes and healthcare delivery. This includes telemedicine, electronic health records, wearable devices, mobile health applications, and other forms of digital health technology. To this end, several research and developmental activities in various fields are gaining momentum. For instance, in the medical devices sector, several smart biomedical materials and medical devices that are digitally enabled are rapidly being used through the various stages of drug development, namely computer-aided drug design, computational modeling for predictive toxicology, and big data analytics for clinical trial management. In the biotechnology and bioengineering fields, investigations are rapidly growing focus on digital health, such as omics biology, synthetic biology, systems biology, big data, and personalized medicine. Digital health-focused medical devices are devices that utilizes digital technologies to improve healthcare, and provide these devices are playing an increasingly important role in improving healthcare delivery by enabling remote patient monitoring, increasing access to medical devices, medical services, and reducing healthcare costs. They also offer the potential for improved patient outcomes by enabling early detection and intervention in medical conditions. However, there are also challenges associated with the use of these devices, such as the need for appropriate regulatory oversight, privacy concerns, and attention to cybersecurity risks. Moreover, digital database of organ donor also is on the cards for smooth transplants. The advent of digital healthcare and healthcare provided the way for tremendous development in the field of material science and related research. Modern material science can contribute smart materials and analytical tools suitable for developing wearable medical devices and sensors required for this purpose. The wearable devices could help in the monitoring of chronic health conditions, therapy, diagnosis, rehabilitation, and tracking of physical activities. Timely intervention supported by the real-time monitoring of health parameters using wearable devices would save the lives of many people in the country. The cloud-based operation of wearable medical devices enables medical professionals to monitor real-time vital parameters and to plan the requirement of physical visits, changes in therapy, and modalities for disease management. And the list goes on and on endless. Today we are in a digital world, as I said. I'm sure the sessions which we are going to have is going to take us next level as to how to reach out to the people, especially of the rural India, where the healthcare is skewed, the healthcare professionals, the facilities available in India is skewed ratio. I'm sure the digital is going to take us to the next level, and the whole day we are going to have wonderful sessions and have a wonderful seminar, and we learn from each other a lot of devices and a lot of the startup. It's been a part of the India government project. A lot of things have been part of the mainstream now. Let's hope we will also utilize these things and improve the service which we are giving to the entire country in terms of healthcare service to the country.
Thank you, Father George, for addressing the gathering. Now may I request Dr. Upasana Arora, Managing Director, Yashoda Super Speciality Hospital, which based out of Ghaziabad. You must have heard a lot of, FM radio which comes into that. Madam, congratulations. Please welcome Madam Dr. Upasana Arora.
Good morning, everyone. I think everybody must have taken their tea or coffee. So everyone is awake? Yes. Thank you so much. First of all, I would like to thank this conference organizer who called me, and I am here. Rather, this is a new gathering I am meeting because I am a conference fellow. I am going everywhere, but it's a totally new crowd I can see as well, panelists as well as our audience. So anyhow, digital health is a need of era. Reason behind this, we actually need to provide, our population is, I think, number one in the world, everybody knows, so we need more hands. Our government has tried a lot and they, started new medical colleges. We got first time in my life, now I am 55, so you can understand, in my life that government is thinking about some nursing colleges and all. Otherwise, health was not priority for anyone. So this is a very good time when if we want to implement something, government is actually very favorable for healthcare. That is what Ayushman Bharat is here. And Ayushman Bharat is also depending on digital health, ABDM. I am very lucky that I am part of committee of Ayushman Bharat. So you can understand when this ABHA will be implemented everywhere, how easy it will be. Like I travel a lot. Half of the time I am some other country or city. So if that kind of facility will be available that I can go to any hospital and I will just tell my name or my ID and I can see whole my records, so need not to carry all the time big papers. Same time, hospitals are providing end-to-end care for the patient, but after discharge, what is happening with the patient, no one knows. So, with the digitization of the healthcare, it is very easy, rather because I run hospital, basically I'm involved in day-to-day activities, so lots of companies are coming to me and they are showing their gadgets. Before you told that go and visit, I already visited everything and I invited everybody, please come to hospital and show me what special you are doing. Because if you see, IT is actually doing very well everywhere in the world and our engineers, our brains are doing there. Same, doctors are doing very well and our brains are working everywhere in the world. Doctors are become two-in-one. They are not only doctors, they become engineers also, especially software engineers. All hospital equipments are depending on softwares. So like my hospital is doing robotic surgery and doctors has learned like in very quickly and they are doing such a good number of surgery I was not expecting, especially from the gynecologist, because they were not ready to do EMR. But they are doing very well in robotic surgery. So you can understand that after some time, especially in radiology, if we see, all the diagnostic equipments are depending on AI. So this is the time when our India has to adopt, and all the hospitals should adopt digitization. They should adopt new technologies, like I have seen that a small ECG device, which is a very good thing. When somebody is going out, he can at least, when you are not feeling well, at least you can check my ECG is okay. Should I go to a hospital or should I take rest? So these people are doing wonderful job, especially HMS. Now HMS is connected for everything, for all devices. You start from the admission till discharge, you are depending on a software. So I think this conference is very important. And we should, whatever we are learning here, we should not keep it only to ourselves. We are supposed to tell it to our colleagues also. If we know some good company, we are supposed to, tell others that this company is good. Adopt this technology, adopt this equipment, whatever ways we can help them. Because that is how we encourage those who are doing startups. Young boys who have done some IIT and now they started something new. I am using Dozy, which is so helpful. So whatever I use, I tell to others, please use it, it's good. So I mean to say, our organizer has a very good vision that he organized this, and especially panelists who are sitting here, they are such a wonderful people and very, very intellectual, intelligent. So I will not take much time because I am not that much tech savvy, but still I understand, like if I will go out after this conference, I will put only one post on my one social media, and it will go everywhere, like I am using 4 accounts, so everywhere it will post automatically. This is the IT, this is the software, these are the technologies. So we should adopt them, we should support them, and I am always ready for all new things. Everybody knows me in healthcare because for you people I am a new face, But other in quality, I am actually brand ambassador for NABH also, so I am everywhere in quality and healthcare. So everybody knows that Upasana and Yashoda is always ready to adopt all new things, all new equipments, new technologies. So most welcome, please come and show your talent to me. And thank you once again.
Thank you, Dr. Upasana Arora. Whether we like it or not, AI is going to be part of our daily life, and without IT, no hospital can run, and Holy Family Hospital medical director can vouch for it. Dr. Sumitri is here. So, ladies and gentlemen, thank you very much. Having said that, I invite the next speaker, Commander Navneet Bali, Chief Executive Officer, Clear Media Healthcare. Sir, ladies and gentlemen, please welcome Commander.
Thank you very much. At the outset, I would like to thank you, sir, for inviting me here. Now, before joining Clear Media Healthcare, for 6 years I was in the Mecca of healthcare called Narayana Health, where I established the North region for NH. We had a hospital in Katra. If many of you have gone to Vaishno Devi, it's a small village. And then 3 more hospitals here. And before that, international oncology, where again we had cancer centers in Tier 2, Tier 3 cities. And now in Clear Media Healthcare, we just started a hospital in Gwalior. We have hospitals in a small village next to Baroda. It's Kailash Cancer Center. We have 3 linear accelerators who treat around 200 patients on the couch every day. Please get out of Delhi, travel for 1 hour, and you'll start understanding the healthcare scenario in India. It's dramatically different than what we are here right now and what we talk about. It's completely different. I was in Nanded yesterday. We have a hospital in Nanded. As you're aware, Nanded is a small town in Maharashtra. And we just adopted a new HIS system, and I asked the hospital that why don't we tell patients to come on the app, and why don't we want patients to be digitally aware? He said almost like 100 patients on couch on linear accelerator there, huge amount of cancer burden. And they said that patients don't want to, because they still want to carry a file, because it gives them that sense of they're carrying something with them, and then they go here and there with the file. So 2 aspects of the whole situation right now. Great amount of advancements been done in IT, no doubt about it. We got fantastic digital transformation happening. But if you really ask me, the pace of this digital transformation, or what we are going through, has been extremely, extremely slow in healthcare. I think you started using Ola and Uber many years back. You started booking your movie tickets and Book My Show, etc. You started booking the airline tickets. But if I ask how many of you are today using an app to book an appointment in hospital, I think it'll be just about 5% of you, that's all. Almost none of you will have an ABHA ID. And almost 80% of you will not be using a wearable device or monitoring your health parameters on a digital platform at all. So what I'm trying to tell you is that although the technology in this case has gone much ahead of what it should be, the adoption is still a very poor, dismal part of the entire ecosystem. Now, where does it bring us? So let's first understand the problem. I'll just take 2-3 more minutes. We got 140 crores of us. Out of that, some of us are covered by some panels, etc., ECHS, CGHS, ESI. Some of us are ultra rich who don't need anything. Then a part of us are covered by Ayushman Bharat. As you know, the family gets covered by around 5 lakh rupees, for the entire family. Some states like Jammu Kashmir, Rajasthan have got 100% Ayushman Bharat coverage. So whoever you are, you could come with a card and come to an hospital. But there are about 60 to 70 crore Indians who are neither covered by anything at all, zero. They have no coverage, they are nothing, and as you're aware, our out-of-pocket expenditure was highest, one of the highest in the world, somewhere around 58 to 60%. The data tells me that it has come down now, but still a very, again, and not a picture which is we need to be very happy about. So what is the solution of the problem? We all know the problem. And by the way, this gathering here is more of a knowledge sharing, experience sharing, where people sitting on the dais and, in the hall can then go and talk about it somewhere else, and maybe it makes some difference in a small village and a town. So the problem, we know, the solution is actually through digitalization or digital adoption, and a genie called insurance. As you're aware, I mean, healthcare insurance has shown a great promise, but not the way healthcare insurance is today, where you pay a huge amount of premium, you go to a hospital, and still you are not paid for your expenses, and you're aware. So I think the combination of insurance and digital steps and their percolation down to small towns and villages actually is going to really transform Indian healthcare. But I'll go one step further. We are just too many of us to be treated in hospitals. Too many, 140 crores of us. I think if you really want to look at Indian healthcare and our population to be much more healthy, I think we need to move towards wellness, whether we use digital methods, we use technology, we use AI, or whatever you want to use. Since we are too many of us, the first step has to be wellness. The second step has to be adoption of digital means into the smallest towns and cities of India. The third has to be insurance. And a combination of all these three things, maybe in next 5 to 10 years, we'll see us completely change the scenario that we are facing right now. As you're aware, truly speaking, if a poor person has to today go and get his cancer treated in a hospital, believe you me, even if he has an Ayushman Bharat card, he still won't be able to get the completely treated. Okay, that's the truth of the situation. Because I run hospitals in these small remote areas, I've been to the smaller towns and places, it's extremely difficult. But yes, there's a promise in the air. As I talked about, there are so many things that we are very optimistic about it. And please never ever discount the power of policy. And as Dr. Upasana also spoke about, the government is quite proactive. And I think policies are much, again, for a country like us, I think policy interventions by government are going to also lead the way. So with that, I just want to say that there is a huge amount of, I would say, hope in the air. But yes, it has to be clicking of all these factors together if we want to really see us move towards the glorious era where Indians don't have to bother about how much money they have in their pocket, and they get treated in the best hospitals in the country. Thank you so much.
Thank you, sir. I agree with you. The rural areas, one hour from drive from Delhi, you see the healthcare of this. So we also have a director from Bijnor Hospital here. He was sharing with me the kind of problem they are facing. You know, first the doctors and then the patients. So both, so both. And what you said is the healthcare app. I do agree, we all have a healthcare app, but the problem is we don't do a publicity kind of a thing. Everybody still prefer a print. Mera appointment kitne baje hai? 11 baje ka hai. Prefer to have a, in writing. So that's what India. But I do agree we need to move slowly into the digital. And that's where we started this conference, that we need to move into the digital. Ladies and gentlemen, I'd like to welcome Father Sabu PL, Director Fatima Hospital, Gorakhpur. He is also the Vice President of RUPCHA Association of India. Father, join us.
Good morning, everyone. Respected dignitaries on the dais and respected delegates from various organizations and hospitals, healthcare systems. Myself, Father Sabu from Fatima Hospital, Gorakhpur. Speak on to digital technologies are now integral to daily life. And the world's population has never been more interconnected. Innovation, particularly in the digital sphere, is happening at unprecedented scale. Even so, its application to improve the health of populations remains largely untapped. And there is immense scope for use of digital health solutions, as already mentioned by our speakers. Digital transformation of healthcare can be disruptive. However, technologies such as the Internet of Things, virtual care, remote monitoring, artificial intelligence, big data analytics, blockchain, smart wearables, platforms, tools enabling data exchange and storage, and tools enabling remote data capture, and the exchange of data and sharing of relevant information across the health ecosystem, creating a continuum of care, have proven potential to enhance health outcomes by improving medical diagnosis, data-based treatment decisions, digital therapeutics, clinical trials, self-management of care and person-centered care, as well as creating more evidence-based knowledge, skills and competence for professionals to support healthcare. Digital health should be an integral part of health priorities and benefit people in a way that is ethical, safe, secure, reliable, equitable, and sustainable. It should be developed with the principles of transparency, accessibility, scalability, replicability, interoperability, privacy, security, and confidentiality. The vision of the global strategy is to improve health for everyone, everywhere, by accelerating the development and adoption of appropriate, accessible, affordable, scalable, and sustainable person-centric digital health solutions to prevent, detect, and respond to epidemics and pandemics, developing infrastructure and applications that enable countries to use health data to promote health and well-being and to achieve the health-related sustainable development goals and the triple billion targets of WHO's 13th General Program of Work, 2019 to 2023. Digital health will be valued and adopted if it is accessible and supports equitable and universal access to quality healthcare services, enhances the efficiency and sustainability of health systems in developing quality, affordable, and equitable care, and strengthens and scales up health promotion, disease prevention, diagnosis, management, rehabilitation, and palliative care, including before, during, and after epidemic or pandemic, in a system that respects the privacy and security of patient health information. The vision further seeks to enhance research and development, innovation and collaboration across sectors. It recognizes that digital health can radically change health outcomes if it is supported by sufficient investment in governance, institutional and workforce capacity to enable the changes in digital systems and data use, training, planning, and management that are required as health systems and services are increasingly digitized. With this essential investment in people and processes, in line with the national strategies that lay out a vision for the digitalization of the health sector, digital health can improve the efficiency and cost effectiveness of care, allowing for new business models in the delivery of services. The Catholic Health Association of India, CHAI, mooted the idea of decentralization in the 80s. That gave rise to the formation of regional units. Member institutions belonging to various geographic regions got together and formed the regional units. Presently, there are 11 such units of CHAI. Even though Rajasthan Uttar Pradesh Catholic Health Association, in short form, RUPCHA, the largest regional unit of CHAI, was formed during the second half of 1980s. It started functioning actively in the year 1988 onwards with the assistance of CHAI zonal office at Delhi. It was registered under the Society's Registration Act 1860 on 14th March 1991. Since then, it has been growing steadily and playing an effective role in the promotion of the comprehensive and holistic process of community health in the region. We, the RUPCHA family, is spread in 7 states and 3 union territories with 235 member institutions having a total 6,000 bed capacity in this northern part of India. Already, many of our centers in the remote areas are digitalized with online consultation facility and telemedicine. I am also coming from the northern part of Uttar Pradesh, Purvanchal, Gorakhpur. We have some 10 satellite clinics, 7 vision centers. Many of our sister concerns, our sister religious sisters are using telemedicine program and online consultation program in their own centers. We are in the process of digitalization and ease of doing the healthcare services. Our deep appreciation to BE exhibition for organizing today's event and making RUPCHA a major stakeholder in the North India as part of this program. Thank you very much for patient listening. Jai Hind.
Thank you, Father. That's what the RUPCHA is doing around the northern part of this country. Ladies and gentlemen, now let's welcome Shri Arvind Kumar, Director General Software Technology Parks of India, which is called STPI. They are doing a lot of funding for the medical startup companies, and you can see a few of them are here. Ladies and gentlemen, put hands together in welcoming Shri Arvind Kumar.
Good afternoon. It's really proud privilege to be part of this very health tech digital healthcare summit. Sri Robert Ravi is my colleague in TRA, and I'm truly technology man. You know, we are talking about the 5G right now. People are using 5G right now, but he's talked this maybe 6 years, 7 years back. So truly technology man. Is really glad to see him on this very conference. Sasi is my old friend, and I think it's very good that he has entered from technology to healthcare as well. It's really. All distinguished delegates from various fields, on the dais, off the dais, backbone of this whole country, health system, our sisters. They are really backbone of health system of this country. You know, now we are in the era of technology disruption. I'm not going to talk about using IT system for hospital management. I mean, this is done. HRMS of the hospital is done. Now this whole new tech has triggered a different domain altogether. This new, when we call this new tech, this is we calling artificial intelligence, machine learning, data analytics, genomics, one side, which can handle million data. And the other side is 5G, so that it can reach to anybody, anywhere in this country, AR, VR. So there are two parts of the technology. One is about handling the data, another about the reaching the data, AR, VR, which is ensuring that everything reaches to the masses of this country. And these two together triggering to almost different paradigm of the medical and health system in this world. But I'm sure India is going to lead it. There are regions behind it. The important part for the health system is that everybody has the different human body. It is a different composition. So in India, we have 1.3 billion data point, if you consider one as a person. Then it has millions and billions of the cells and neurons. So just think these data. Till now, all the studies, because there was a technology limitations, you can't handle such a huge volume of the data. So we are working only on the sampling theory, right? Today, drug discovery take 10 to 15 years. you have to first test on some animals, then you have to test the drug on the people who have very high immunity, then you have to go to the masses, but you don't know whether this drug is suitable to me or not. This is just an statistics. But this paradigm is going to change. You can have the drug discovery for each and every person individually. Which drug is suitable to whom? We can create digital twin. We can create digital twins of everybody. And the digital twin, you can do the experiment on that very digital twins. So we are going to talk, I'm going to talk how this is going to change discovery and drugs and how it is going to be useful for the humankind in general. How it is going to use for medical devices. Now we are not the country who is doing some conventional research. We are now in deep tech. This is the new trend which has been emerged in this country, that now we are excelling. We are doing best in the world on deep tech. And deep tech most useful case could be the medical science. And I'm really very glad that this engineers one side and medical professional other side are sitting together. Actually, this kind of the collaboration is the need of hour. I must thank Bharat Exhibition and Shashi Dhuran who brought doctors and engineers together. Those generally are working in silos. Third is, I said, healthcare management, patient care management. It is in any cases happening because IT has developed so much. Now, when I say drugs take 10 to 15 years to come into the market, we have to find, and this is what the startup today needed. A startup needed only the problem statement. And who can give the problem statement? Today, startup is not requiring funding. They'll have lot of funding source. They can get the fund if they can get right consumer to the product they are developing. Now, what product they should develop? They should develop the product which is required by the industry. So, who can give the direct right problem statement to them? Good hospitals, doctors, pharmaceutical companies. They can give what kind of problem they are facing when they are doing the drug discovery. And this drug discovery concept should be changed into maybe drug design, maybe drug engineering, maybe drug modeling. And it should not take 10 to 15 years. And it should be very personalized to everybody. This kind of the problem statement is just responsibility of our pharmaceutical company to give the right problem statement to our startups who is working in artificial intelligence, who is working in machine learning, who is working in data analytics. Then this problem is very much solvable and we can lead, like we always be in the pharmacy of the world that we have shown in this COVID era, and we can tomorrow become that all digital health technologies coming from our country. Second is about the devices. Today, if there is a knee implant, you know, when the doctors put the cut there, then only they know how much bone has to be broken, cut, how much portion has to be cut. If they don't know how much blood will flow, they don't know how much recovery time will be. But I think this technology, if this artificial intelligence technology is just provided along with all kind of the statistics, MRI, X-ray, everything, they can very well make a very next guess that yes, this will be the recovery time, this will be the blood flow, and this kind of the cut is required for this very knee implant. But who will give this problem statement? Artificial intelligence people, technology people knows how to solve this problem, but somebody should tell the nuance of that very problem. And this has to be done. This has to be done immediately. Similarly, we should create, I said, digital twins. Tomorrow biggest problem is our senior citizens. They always go to hospital multiple times. All right. What is the problem? Sometimes they fell down. Can we create some digital twin? Can we create something which is similar to that very person, and you can always do some prediction? Yes, this problem may come at this point of time, and they may not require to visit hospital always. Third problem is, which is you have not that many doctors as is required. And this problem can very be solved by AR, VR, and the metaverse. Some doctor may be sitting in London. You can have feel of that very patient, that very operations through this metaverse. Fourth, which I can understand is this, is called digital therapy. And digital therapy, today we have all conventional method of digital therapy. You just give the ball, you kept moving this. This is all traditional methods, not suited to everybody. It is on the basis of statistics. All digital therapy can be created, can be done, personalized using artificial intelligence and all deep tech technologies. Today you don't know, doctor, when you go to neurologist, when you go to orthopedics, they say, okay, there is no medicine for it. Do these 3 exercises, 5 exercises, physiotherapists used to tell you, and your back pain will go. After 2 days, you realize nothing happening. Why not go back to doctor, ask, please give him some pill, it will be okay for me. If you can create some digital prototype of that, so you can see it on your TV, okay, when I am doing exercise, this muscles is being actually released. Because you are not realizing, when you are doing 3 days exercise, to just release that very neurological, I don't know what is happening or not happening. You don't know whether there is a effect of that medicine which I have taken or there is effect of exercise which I am doing. If we can create something good for them, that yes, when you are doing this muscles, when you are doing this exercise, this very muscles is being relaxed, you can measure, yes, yesterday it was, muscles was in this position, tomorrow it will be in this position, you will have encouragement to do it. This is where technology can be used. And as I said, there is a need, I mean, time is essence, time is up already, Sasi has announced. So, we say there is a need of, I must say, collaborative approach, co-innovation approach, and we also running a startup on health tech at Lucknow. It's called Medtech, where we are supporting around 30 startups who are in various domains. There's no time, otherwise I could have explained what exactly they are doing. But there are 3-4 startups who are present here. You can see what they are actually developing. But it's really nice to see them. They are able to produce number of IPRs. Their product is very good. And it's not only us. There are many incubators who are providing a lot of facilities to startup. But I expect from this medical fraternity is kindly adopt some startup, give problem statement to them. Money is not an issue. You are not solving your problem, you are solving a country's problem. So co-innovation model. Thank you very much.
Absolutely agree with you, sir. They are solving the country's problem, the huge population of this country, so that everyone is accessible to the health care. Having said that, we are slightly running late. May I request all of you to put your mobile on a silent mode, as I see some people are talking on the mobile inside the hall, which disturbs the panel and of course the other delegates, those who want to listen. Sorry for that. I will not request you to switch it off, but just put it on a silent. Ladies and gentlemen, let's put hands together in welcoming Shri A. Robert Gerard Ravi, ITS officer from Department of Telecommunications. When he, what Arvind sir has said is right. He was talking about 5G use cases. Now me and he started talking the 6G use cases. That was a beautiful thing which we did 2 weeks back. Me and Robert sir, we've been talking. What are the use cases for 6G and how 6G is going to play a vital role in the healthcare sector. Sir, over to you.
Thank you, Shashi. It's always good to come to some events wherever you're arranging, especially such events. A long-time friend. And my dear Arvind, we have a long association. As you rightly told, we have both on the tech side. So he is helping on the startups. We from the government, we try to see what best we are trying to do. and dignitaries on the stage, ladies and gentlemen. It's again a pleasure to be around with you for this summit. I'm not going to touch much on real technology because it's been talked. I want to just put a few facts before it, then just pass a bit and see what we are, where we are, and what we are, what we can do. Going back to our basics of what we call about sustainability. So when you have the UN goals, what are the three main essential goals on the health sector we are talking about? Acceptability, affordability, and availability. Today, is the healthcare affordable, acceptable, and available? How far we are done? We talk about digital transformation. That's the main topic to talk. Digital transformation of the health sector. How are we going to put the pillars? The government has done a lot of efforts. I think you might have seen in the last few years. We've been pushing a lot on the health sector. Now, the entire digital transformation of the health is going to anchor itself on 4 key pillars. What are the key pillars? One is, of course, affordable. How affordable your health? Whether these health services are available, access to health. Access to health. Next is how decentralized these health facilities are there. Can it all be available, decentralized up to the rural areas? Third is, can I bring in technology? How smartly we can give these activities to the public? And of course, the affordability. These are the 4 pillars on which any transformation, if you think, on the health needs to be done. Let us go a bit of statistics and say, yes, we all know that. Arvind clearly pointed out. Health sector is one of the largest sector today in the country. We actually, not only for the country, the international, I'll just come to what we say, the medical tourism, a lot of happenings are happening in exactly the health sector. But what do the stats says? Fortunately, 1 year back, the government stepped in and put it up a lot of PPP, partnership, pressing insurances, etc. Today, we are fortunate, at least 70% of the population today have some sort of a health access available. But still, we have 30% not access. 1 year back, it was still bad. So as the private sector and the health and the government, we are pushing. Are we only concentrating only on the urban centers? How are we going to take the rural centers? It's a very big. I think, as she told, I was probably 1 year back around in Tamil Nadu as CTO. We were trying to say that, how do I take whatever I was available in the urban centers like Chennai, can I take this to my PHCs, which is available in my rural areas? What is preventing us from doing it? We have the technology available. We have every means is available. Can we do that? That's how, like what Arvind says, we have a number of startups. We started funding these startups, coming up with ideas. How can they use technology? They came up with beautiful technology called what we call ATM, health ATMs, where something like a kiosk could be built. Somebody can go and put their hand. All parameters, I think 30, 35 parameters captured, sent to a common place, and then the doctor can analyze and come back. These are some of the examples. So we have a lot of other activities still we need to do. For the statistics, 30% still not covered. We don't have access. Another alarming rate, 70% of all the heart attacks is happening in the country. We claim so much, but still it's happening. We are still, because as I say, the availability, affordability, how soon we are able to access, is still a big, big problem. There is no problem in even, say, following some of the models that is happening across. So for example, the other day we were having some dialogue with, because health is a very real important subject. We all know that we gave the vaccine to the world, you know that. But the other side of the story is also existing. So when we are talking about to some government agencies in Philippines done a very, very interesting. On the mountain top, they can do an MRI scan on the real time. Can we not copy that? We talk about Colombia. It's again an almost similar country. They have developed something like smart clinics, smart establishments. We talked about telemedicine. I can share you, telemedicine is nothing new. Way back in 2009, when I was there, we used to run a telemedicine facility, connecting the hospitals, and of course, we did it on a small scale. Very interestingly, we found it was done on the coastal area of the Kadalur, Pondicherry, Chennai area, and we found there were a specific disease which is only available in these coastal regions, which were not even available to the mainstream. So these guys were brought to these the common government GH, and then we came up with ideas. So what I'm trying to say is, the country is a vast country. We still need to put our things done. That is where the first access is available. Second is how decentralized we are doing it. Fortunately, we have technology available. We have 5G. We have opened up 5G corridors. Today, if you see that, the green corridors, when you want to have a transport system available, we are in the process of building what we call intelligent automation transfer system, which means if a vehicle or ambulance need to be moving, all the connected vehicles around will automatically give way and a green corridor will be made available. This is one of the use cases which we are trying to build in 6G happening. Another use case is, I think Shashi was talking about 6G. It's another a few years away, but we have still started testing of some of them. One very interesting use case for the medical side will be your wearables. We will all shortly go away with these smartphones. Smartphones is going to be a story of the past. We are going to have only wearables. So using these wearables, how we are going to connect your wearables? I know you already have that we can monitor the basic health parameters. But suppose I walk in a road and then due to some reason I fall down. The wearables can connect and they can automatically connect to an hospital and then an ambulance can come and pick. That's some of the use cases which we have built. This is of course again the urban side. Again going back to the rural. We did a very, very interesting case study. Because this is the right forum. What I request to you, we have the engineers, as Aravind was telling, we have doctors, we have the engineers, we have startups coming up. I request you to only think about how effectively the rural people also should have an equal facility, what is available in urban. How are we going to do it? We did a very, very interesting case. One I told about that ATM, health ATM. The next very important thing is, of course, there's a research going on in IIT Chennai on this particular aspect. So can we build some sort of a small capsule? I think the doctor is available there. We did something so like what we call an endoscopic small capsule available with a small camera, which could be swallowed in, and then without invasive pressure, key parameters, 10 parameters, I'm very sure doctors will be able to say, if these 10 parameters have been captured, can I detect what type of disease is there? And these devices, right now it is available for 20,000 rupees, maybe we are trying to bring it down to 1,000, 2,000 rupees, accessible, government can even fund it, 1,000, 2,000 is not, when a lot of incidents is happening. So just imagine a scenario, I have a PHC in my village available, people walk into it, we give this capsule, he swallows it, gets the information, and that assimilation happens on time, a big data analytic happens, and then a doctor sitting some far away can even analyze it, depending upon the need. For example, it's cancerous, or it could be heart-related, it could be gastro-related, the experts' information can go on. Can we not build some sort of system which does automatically? This technology is available, we are all pushing it in a big way. That's one key thing that we can see that, can I make a society that is healthy? Our ultimate aim will be, though the doctors may not like, no one should be having any health-related activities in the world. Can you not do it? That's what is we have to do. The technology is available. Can we build an environment which is a healthy environment for all? Let me go back a bit on this. A lot of researches is going on. I think Arvind touched upon the can I do targeted analysis of your drug management. This is a very, very interesting topic. Material science and biotech which is going on. Say for example, in any of this, not only the drug, can I compartmentalize, say every patient's data, like genes, for example, analysis of genetic analysis. I'm sure the doctors are aware. There are 63 genes available which is responsible for this aging and other related things. Some sort of a genetic immortality. Can we think about it? We don't want to be immortal, but at least can we be a healthy human being using the 63 genes? The technology is available. How? Let me again go back. We are setting up what we have quantum labs, quantum computing. Earlier, the molecules of these genes to be detected and is really, really difficult. That's what Arvind told. It takes 15 years. But today with the advancement like quantum computing in place, right now as we speak, we are setting up a full-fledged established quantum computers up and running in Chennai. We have our own Indian quantum as a service available in Bangalore. Suppose you have the data set of the people, what is available. Can I put into this computing facility and on the fly get to know which is the exact gene which you require to check. And this you can even put with big data analytics. I can analyze big and I can categorize. Because what the Indianized environment and the European environment is totally different. Can I make something for the Indian environment? All this comes on big data analytics. Most interestingly, I talked about the 4 pillars. The second pillar is decentralizing. Decentralizing means I no need to bring all the data to one place and do an analysis. And a very interesting case of, I think, Tamil Nadu. I don't want to quote and quote. We did this because of our eager to help the people. We told, okay, let us take data of all the people. We'll do an analysis. We make an analysis. Unfortunately, we got down into a cloud system where we were not able to retrieve the data. We have to also be careful on the technological other side, what type of environment you're building in. Please ensure that we should have the data security also is a very, very prime thing. So can I host it in my own data? So I used to always talk, whenever I meet the startups, health startups come, sir, we have developed this, it goes on the cloud. The first essence is how secure it goes on the cloud, what is the data? So my request, I'm sure, STPI, Arvind, and we have the NIC, we have our own government data centers. We are free to open up this to anything amount at low cost. All your data should come to this particular cloud source and do an analysis rather than the other going outside. This is another very important thing which people should think in the long run. I can also go on giving examples. Apart from this use of technology in these areas, another very critical area is how do I do predictive analysis. I was working in Uganda for long back, maybe 3-4 years back when I was in Uganda. You know that there is a virus called the Ebola virus. Ebola is very, very powerful. It's very dangerous. And we wanted to find out a way of how do we prevent it. Deaths used to happen because of Ebola. So what we did, we took, with the help of UN, we took the data of the stamp base, and then we know the area. We were able to predict using big data analytics, AI analytics. We used to predict and say, there could be a probability of outbreak in this particular area when particular scenario is like that. We were able to, that's the first thing. Second thing is random check of analysis of the borders. It actually originates in Congo, those of Ebola, though they call it the Ugandan thing, but it originated in Congo. So whenever the guys from Congo gets passed on, we were able to predict in the first 1 week of the outbreak itself. In 2016, probably it was the first year, we were able to effectively, to reasonable extent control the Ebola outbreak. So this is one example. So I'm trying to say is the technology is available. We have the AI, we have satellite-based maps available for your analysis. We can even do AI on the top. You can even use edge computing, even at remote areas also can work as your computing and develop its own model. You don't need to send all the modeling here. All the technology is available. Only what is available, as Arvind was also telling, let us take the problem statement. The problem statement today is, can I make rural on par with urban? Second, that is what we call access, decentralized access. For the startups available here, another very, very critical thing which I wanted to say is, any analysis which you do, for example, you say, I put my machine, I did my measurement, my BP is so much, my sugar level is so much. How are you validating it? If a doctor or someone or a hospital is going to own it, how are we going to validate it? There is some agencies, I think you're all aware, the startups. I request the startups, whenever you do it, parallelly you should also start engaging with these registered bodies. And you know that unless the accuracy rate is 98%, you will not be given a certificate of validity of use of this product. That is what your medical MCI says, the old MCI states. So we should not get bottled. See, we should not blame the doctors. They're not adopting the technology because they're not able to adopt the technologies. Are you able to prove what you're delivering is on par with what has been registered? So my request to the techno people or the startups also is, whenever you start doing it, kindly see that you register yourself and then ensure that registration is in place so that at least we meet the 98%. So these are some of the problem statements I have thrown up. I'm very sure we have to create a world which is healthy, is possible, because we are We are the, what do you say, the actual doctors of the world, we can say. We are the vaccines of the world, we claim. But really we have to do. Another very important, I talked about the medical tourism. Even today, some certain countries like Africa totally depend only on India. So can we not do our own country itself? That is what the government is pushing in a big way. The government of India is supporting all its efforts to make and bridge this gap. Ensure these 4 pillars are really, you make it affordable, you make the access to health as easy as possible, you decentralize the data up to the rural, and the last and very important, how smartly we can do it. With these few words, thank you for the opportunity. Let us make an healthy India. Thank you.
So thank you so much. I agree that affordable healthcare, whether we use it digital or whatever it is, and without digital, no more healthcare. So affordable healthcare is very important. Having said that, Deloitte has come out with a beautiful report, The Future of Health in India. So now I request all the dignitaries on the dais, please release this book on the stand. I request Shri Robert Treviji to launch this book along with everyone. So ladies and gentlemen, this is the book which is on the future of health in India. So to talk about what is this book, may I request Mr. Joydeep Ghosh, partner and industry leader, life science and healthcare industry from Deloitte India. Sir.
Good afternoon, everyone. The advantage of speaking after such a distinguished panel of speakers is that everybody is well and truly woken up, because a lot of important points, very important points have been made. The bad thing is, of course, that I don't have too much left to say, because what I wanted to say and the points I had prepared painstakingly over the last couple of days is more or less all spent. But that tells me something, is that you're on the right track if all of the distinguished panelists have had similar remarks that is corroborative of what our thought process and our report has been, which we have just launched, as you can see. Still, I'd like to particularly thank that it's a matter of privilege and honor to speak in front of such a distinguished panel. Dr. Basant Garg, Additional Chief Executive Officer, National Health Authority. I wanted to thank Shri Arvind Kumar, Director General, STPI, Shri Robert Ravi, for your remarks from the, the previous speaker. Your support and the insights you have given right now on various aspects of technology enablement in the healthcare sector, with the beautiful examples which you have given, really very grateful to you for bringing those to light. Those are very good use cases which we are seeing happening right now in various parts of this country. Maybe the rural-urban divide, we have still probably some way to go to bridge that. But some of the strategies which we have suggested in our report, using hospitals without walls, satellites and kiosks, telemedicine, telehealth, are some of those which will bridge those gaps, but we are cognizant of that. A lot of thanks to Shashi for Bharat Exhibitions for allowing us this platform to launch our event. I'll speak 2 minutes about how the technology enablement of this healthcare sector is going to affect our lives going forward. Having said that, in our report also, we have pretty much dwelled on the most important technologies: 5G, AI-enabled healthcare, IoT, wearable devices, IoMT, sometimes those are called, various security aspects of it, which some of which also came up, were highlighted in the panel, which are important aspects of it. Generative AI, AI/ML is becoming all pervasive, as Madam yourself, you also remarked in your speech. We have dwelt upon those topics in our report. However, some of the things which probably have not been said so far, I'll quickly add to that. One of the primary reasons for this shift in healthcare is not only because of the availability of technologies, disruptive technologies, which collaboration between doctors and engineers is bringing to the table, but also because of the paradigm shift in the mind of the consumer. And that probably, though we may be seeing it more prevalent in the urban areas where people are getting or willing to take more control of their own health, which is kind of evinced by the fact that between 2012 and now, the monthly spending of families on healthcare increased twice, from 3% 2012 to around 5.9% recently. So it's not that that is entirely prevalent to the country. The rural-urban divide remains. And that also is accentuated to the fact that most of our super specialty hospitals, most of our best doctors are probably concentrated more on urban areas, and our population is spread out much more. One of the other remarks which I picked up very well is that we are simply too many. I think some of you made that remark. That's absolutely spot on. And the only way, probably we will not be able to, the targets of WHO, so many hospitals, beds per population for thousands or 10,000 population, so many nurses per 10,000 population, we will really struggle to achieve those. A, because we are too many. Number two, we are spread across too many areas which are very underserved. And some of the areas, for Spiti Valley, for example, is cut off half the year. How do you deliver healthcare there, which is cut off half the year? There are places which are very difficult to reach. We have infrastructural challenges, we have technology challenges, we have social challenges as well. While internet, has permeated a lot to our population, still the divide between the female population using internet is still much lower than the male population. These are things which will improve over time. And how we address those things is a matter of, as somebody said, and one of my co-panelists said, never discount the power of policy. So policy is extremely important. I'm very glad to note, and our report dwells upon that as well, the achievements of Ayushman Bharat, all the schemes around it, e-Sanjeevani. These are the building blocks of our national digital health of the future. This subject is as important as our national security. As we saw during COVID times, how important it is. It could grind any economy to a halt. These are some of the subjects which we have dwelled on that. So we have talked about the demand and supply sides, that is what kind of technologies are available, how those can be deployed to improve the quality of human health, how to bridge the gaps, particularly in underserved rural areas which are difficult to reach. We have talked about how the mindset of the population is changing. People who were earlier used to carrying a token in a bank and a check, they today have learned to use UPI, and that's pretty much permeated at a very fast pace. And it has happened nowhere else in the world other than in our country. We're very, very proud of that. Why can't it happen for the health scheme as well? That is as much interoperability, accessibility, affordability as you can talk about. If we can do that for FS sector, why can't we do that for health sector? That's far more important, isn't it, to all of us? So that's some of the demand and supply side challenges we have talked about. We have talked about technology, infrastructure challenges, social economic challenges. And lastly, we have come up with a roadmap in the medium, short term and long term, how those kind of gaps can be bridged. In all of this journey, data will be key. So the DPDP Act, which has come up recently, is one of the key pillars to protecting the privacy of our citizens. We have talked about interoperability. We have talked about usage of generative AI and AI in terms of clinical decision making, because obviously our doctors are probably our doctors and healthcare professionals, salute to them. They're probably the most overworked anywhere in the world, and they still deliver a fantastic job. Really, ladies and gentlemen, I request you to put hands together for the nurses and doctors who are sitting in this room. And I'll end by saying that while we always say that technology can do this or that for you, yes, of course it can, and over a period of time it will prove itself, including digital twins and things like that. But one needs to also appreciate that of all the technologies, of all the things which we are able to do in our human daily life, probably some of the least understood things is the human body. I'll make a quote from, I'll try to figure out where this quote is from. Vas Narasimhan, the CEO of Novartis, he made a statement. What's often lost on people is how incredible is that we find human medicines at all. Our body is about 40 trillion cells working together. Out of that, we have only about 1,200 druggable proteins. Only a fraction of that we understand. So if you look at the records which have been kept with various drug agencies, more than 120 years, probably a few hundred proteins are discovered which are non-overlapping. Obviously, there are a lot of overlapping therapeutic areas in the drugs that have been discovered. So the fact that our understanding of the human body, both in health and in disease, is rather rudimentary. And the fact that it's so difficult to find systems, protocols, and processes which can address the diseased human body, we still have a long way to catch up in developing technology solutions which will address all of that. The science is really difficult, as opposed to many other areas where it may not be, that challenging. And that too, here, if a mistake happens, that mistake is extremely costly. A life is what is in the bargain. It's not like losing a few thousand rupees or something like that if you have a banking scam. It's of a very different order, isn't it? So with that appreciation, and with the appreciation that there are new technologies which we absolutely need to adopt, need to encourage, and need to vouch for, which will help our digital health mission in our country, across the length and width of the country, particularly in the hitherto underserved areas, is what I would hope. And with all of everybody's support, including the distinguished panelists, all of you in the room, the medical fraternity, the tech fraternity, the startups, I hope for all our continued success. Thanks a lot.
Thank you so much. We are running late as we have a beautiful panel. The next one, all the panels are very good. So I request Shri Robert Rivi to present a memento to our distinguished panelists on the inaugural session on behalf of Bharat exhibition. First to Father George P.A. Father, thank you very much for joining us and addressing us on this thing. Then to Dr. Upasana Arora, Managing Director, Yashoda Super Speciality Hospital. Thank you, Madam. Thank you to be here with us and sharing your views on the digital health. Commander Navneet Bali, the Chief Executive Officer, Clear Mary Healthcare. Sir, thank you so much. Be with us. Then to Father Sabu PL, Director, Fatima Hospital, Gorakhpur. Then the digital man to the software technology park man, Shri Arvind Kumar sir. Then to Mr. Joydeep Ghosh. Anthony will get it in the next session as he is going to moderate the next session. And Robert sir, I have the privilege to present a memento to you. Thank you so much. We come to the end of the inaugural session. We are starting the